Hello, my name is Julie Cornish and I'm a Colo-rectal Consultant in Cardiff and Vale University Health Board. Today I'm going to talk to you about one of the most common things that we see as colorectal surgeons, and that is hemorrhoids, otherwise known as piles. If you have piles, what symptoms might you have? The most common symptom that people complain of who have piles is bleeding from the bottom. This is usually bright red bleeding when you wipe the bottom, or also looking into the toilet itself. Sometimes you may notice a white slimy mucus as well. You may describe itching around the bottom or a firm lump that is very painful to touch. This will often resolve or reduce over a few days. Sometimes people describe having piles for many years, with episodes where they flare up and get extremely painful, and this can last for several days. One thing that people worry about, particularly when they've had bleeding from the bottom, is this anything more serious or is it just piles? One way you can tell is to look at your bowel function. Have you had a change in your bowels in terms of the frequency of going to the toilet? Has the consistency of your poo changed? Have you lost weight? Do you feel more tired than normal? Or are there any other symptoms that have lasted for approximately 6 weeks or more? If you have these, you need to go and see your GP. What can I do if I have an acute flare-up of hemorrhoids, you may be asking? You should take regular pain relief, such as paracetamol. Cocodamol can make you more constipated, and ibuprofen can make bleeding worse if this is becoming a problem for you. You could consider buying over-the-counter medications such as Anusol, or getting some Instilla gel, which contains local anaesthetic as a topical agent to apply around the bottom. If your hemorrhoids are out, then you should try pushing them back in, and you may also try applying ice, although not directly to the skin. Use a clean tea towel or something to apply to the area. In terms of cleaning after you've gone to the toilet, you may find that going to the shower and cleaning or using a sitz bath may make this more manageable. To manage hemorrhoids in the long term, it's important to avoid constipation. Try to drink plenty of water. Use stool softening agents such as Fibergel and Movicol. Try and avoid using stimulant laxatives if possible. You could consider using something along the lines of psyllium husk, linseed, flaxseed, and you can buy these from supermarket or health food stores. If you've tried all these measures and you're still having problems, please go and see your GP. Most hemorrhoids will settle on their own or be managed with simple conservative measures and do not need surgery. But sometimes things don't settle down and you need to seek help. Thank you for watching.